All right, we have some breaking news for you. President Biden has tested negative for COVID-19 last night and again this morning. So that is the news that we just saw from the physician to the President of the United States. That's Dr. Kevin O'Connor. He sent a memorandum again to Karine Jean-Pierre, who's the press secretary. President Biden completed his 5-day course of Paxlovid 36 hours ago. As of this morning, he completed 5 full days of isolation. He is fever-free, and he has discontinued any use of Tylenol for the past 36 hours. Yesterday and again this evening, he tested negative for SARS-CoV-2.
Yeah, so this is what we expected because things were going well in terms of his recovery. For more on this, I wanted to bring in Chief White House correspondent Nancy Cordes. Well, I say we expected it. We didn't know exactly when, but to now see it on paper and see that he tested negative yesterday evening and then again this morning, I'm sure is good news because he wants to sort of get back to business as usual, if you will.
Sure, and I would say that most doctors would probably tell you not that surprising for someone who has taken a 5-day course of Paxlovid that they would start testing negative again fairly quickly, and he has. Now that he has finished his 5 full days of isolation, his doctor says he is ready to rejoin his colleagues in the working world here at the White House. However, Dr. O'Connor does add in this letter that the president will wear a well-fitting mask for 10 full days anytime he is around others. The letter doesn't make it exactly clear whether he means 10 full days from today. I suspect what he means is 10 full days from the date of infection, and therefore he would continue to wear a mask for 5 more days anytime he's in close proximity to others. The president has now announced that he will be speaking from the Rose Garden in just about an hour. So clearly very eager to get back among among others. And we don't have any particular topic that he's going to be talking about. Perhaps he'll be talking about his experience with COVID. Hopefully he'll take some questions from those of us in the press. But that was just added to his schedule only minutes after we got this letter from Dr. O'Connor. I will point out, and this is very interesting in the letter, that Dr. O'Connor says that the president is going to increase his testing cadence over the next week or so because of the potential for so-called rebound COVID. What he means by that is that it has been demonstrated that sometimes people who take Paxlovid will rebound about a week after they start testing negative, and they'll start testing positive again for a few days. This is something that I personally experienced, and so they're going to increase his testing cadence so that if he does turn positive once again, they'll know about it sooner rather than later, and he can begin to isolate again for a few days or whenever he starts testing negative again.
So, Nancy, I know that you mentioned that the president is going to be speaking to the American people in just about an hour, but given that the news just came to you, probably not a sense of the agenda that he wants to talk about, although what a lot of people are talking about is recession.
Right, and I'm sure that will come up. However, what I suspect that he's most eager to talk about is, first of all, to thank the medical personnel who cared for him over the past week or so, to talk about his symptoms and to use this as an opportunity to encourage other Americans to get vaccinated. I'm sure he'll say that part of the reason that his symptoms were so mild from the beginning was the fact that he was double vaccinated and double boosted. And as we head into the fall with a very contagious variant, I'm sure he's looking at this as an opportunity to urge other Americans to take the same course of action that he did, and not only to get vaccinated and boosted, but to take advantage of free treatments like Paxlovid as he did, particularly if individuals are in a high-risk category. But you're absolutely right, Vlad, that if he does take questions, what most reporters are likely to ask him about is a series of economic indicators that are out this week. We expect the Fed today to hike interest rates again by another 3/4 of a point as they try to slow down spending and thereby slow down inflation. And then, of course, tomorrow we're getting those second quarter GDP results, which everyone is watching so closely to see if we're looking at a second straight quarter of reduced growth, often a sign of an impending recession. That's something that the president might want to get out in front of and make the argument once again, as he did in a virtual address the other day, that he doesn't believe we're heading into a recession because there are so many other economic indicators that still look very good: unemployment, investment, that kind of thing.
All right, Nancy Cordes, thank you for that. At the White House, we'll let you get ready for that news conference coming up. We want to bring in now Dr. John Moore. He's a professor of microbiology and immunology from the Weill Cornell Medicine. Thank you so much for joining us. I'm not sure if you have a copy, as we do, of the memorandum that went out just a couple of minutes ago. But when you hear that the president plans to increase his testing cadence after this experience, is that something that stands out to you? And also the idea of wearing sort of this well-fitted mask for 10 days anytime he is around others. Not sure if we're talking, like Nancy said, 10 days from when he was infected or 10 days starting today. But if you could just give us your thoughts about what we're hearing and what we know right now.
Well, it sounds like the president has had a fairly typical disease course for someone who's been fully vaccinated and boosted. The Omicron variants around now cause relatively mild infections in that scenario. Excuse me. He's also had Paxlovid, so that will also help his clearance of virus. So he's had what I think we all expected for someone with his background of boosting and antiviral treatment. So he's following CDC guidelines and resuming work after testing negative. But it's prudent to continue to wear a mask and respect the people around you, because there is still a small risk of passing virus on, even after testing negative in a rapid antigen test of the type that he will have used.
When you say small risk, can you be a little more specific? What are the chances or the likelihood that you can pass this on even after testing negative twice?
Well, pretty low, but rapid antigen tests are not the most sensitive tests available. If he's also testing negative on PCR, which is more sensitive, that would be a greater sign of non-transmissibility. And there's always a chance of this phenomenon called Paxlovid rebound, whereby after a few days after stopping treatment, virus reappears, or at least virus signals reappear, and you test positive again. And Tony Fauci had that experience in June. After testing initially negative, he rebounded and had to resume quarantine. So they'll be aware of this in the White House. It's a rare, but certainly not unprecedented possibility. So they'll be testing regularly to make sure that he doesn't have a Paxlovid rebound. And in the meantime, wearing a mask and people around him wearing a mask just makes sense. It's a low probability event, but if it's easy to take additional precautions, why not do so?
So, Dr. Moore, I have a question. The president was prescribed Paxlovid, and others have been prescribed Paxlovid. But the question, I guess, is for people who, over the course of this pandemic, have been told, look, once you get vaccinated, and even after once you get boosted, the chances of becoming very, very ill with COVID-19 are have lessened. And so, is it because of the president's advanced age that he was given Paxlovid? Because I've heard of also young people getting it, but if you have it and all you have are the sniffles or a runny nose, should you be taking Paxlovid if the risk of that rebound is greater than just riding it out?
Well, Paxlovid is pretty much standard of care for someone in the president's age range, but it's less often used for people younger. It's not standard of care under that setting. So I'm not surprised that the president got it. He would certainly be eligible for it, and it makes sense that he did receive it. But there is this small chance of this rebound phenomenon. But I don't think that should dissuade people from taking it. You can get it on prescription. So it's down to you and your physician who would judge your health status as to whether you get a Paxlovid prescription or not. But certainly in the president's case, he's in the age range whereby it was appropriate and prescribed.
And are you surprised, doctor, that more of the president's close contacts that we're aware of in the hours before he tested positive have not become infected? Is that typical? Because I know you hear these instances where, like, for instance, my daughter had it a while back and I didn't have it for 3 or 4 more weeks. How does that work, that people so close to him who did have contact haven't become infected?
Well, it very much depends on how early his infection was diagnosed, what the severity of his infection was. I mean, the worse the infection, the more likely you are to produce a lot of virus, and the more likely you are to sneeze or breathe it out. and the more likely someone in contact with you will then pick up the virus from you. But there are so many variables here. I mean, he's getting regularly tested. So the first time he had symptoms and had a test, he would be detected very, very early on. Most people are not tested daily. We don't have that capacity. So somebody, Joe Public could be positive for a day and not realize it, and then have a greater chance of passing that infection on to someone else.
That's a good point. Dr. Moore, always great to have you. Thanks for jumping in at the last minute for the breaking news. We appreciate it.
Thank you.
Oh, you're welcome.